Hi, this is Dr. Sunil Tumala. I am a practicing neurologist in Frisco, Texas. Today is May 9, 2021, Sunday. The time now is 4 p.m. Today we are going to talk about three most important topics. One, who is at risk for complications in COVID-19? How can you identify if you are at risk of complications? What you should do if you are in contact with a person who has a current COVID-19 infection. That's called exposure. And what you should do if you have any symptoms concerning for COVID-19. And the last one I'm going to talk about is some current state of affairs regarding COVID-19 in Bharat, that is India. Okay, we'll talk briefly about these things, and I will give you very succinct information that will be very useful to you to reduce your anxiety and fear that you have developed, might have developed by watching all this social media and mainstream news, most of which is probably not reliable nowadays. So let's get started. Okay, so those are the topics for us today. So who is at risk for complications in COVID-19? I would categorize, let's say, people into various risk categories. Let's say if you have been exposed to COVID-19, which only transmits through air or through your hands, through your nose, and then into your lungs. Okay, assume the virus came through the air or through your hands, you touched some contaminated surface, and then you touched your nose, and then the virus entered in large dose into your airway and started infecting. It has to enter into your cell through a receptor, then uses your cell machinery to replicate in a geometric progression, destroys your cells, and then keeps moving on, destroying the cells. That's how it infects. Your immune system obviously works to try to defend. In some cases it is successful, especially if you have a healthy body. If you have an immunodeficiency, or if you have excess immunity, hypersensitivity, autoimmunity, you may even have an immune system that can do harm to you during this COVID-19 infection. Okay, so it's optimal immunity, that is the key, not excess, not low. Okay, so what is your risk of getting a bad outcome? So let's say you have an exposure, assume you are infected with the exposure. So the virus has to bind to the receptor, then only you get infected. It has to be internalized. So you are exposed, and then assume you're infected. Then you have two outcomes. You may have no symptoms, or you may have symptoms. 40% of the population, 30 to 40%, give or take, according to current statistics, have asymptomatic infection. They just carry the virus in their airway. They may be sprinkling into the air and onto surfaces around, infecting others, but they have no symptoms. These are called asymptomatic infections. Okay, so around 40%. In my opinion, it may be a little bit even higher than this number, but in one of the Korean study it says 30%, and I think in US they are quoting around 40%. It could be more, we don't know. If you are, so who are going to be asymptomatic? So the people whose immune system is optimal enough to contain the virus so that it doesn't proliferate too much, and it is mounting an exact immune response as necessary to counteract that viral infection. So you have no symptoms. So it contained it. So this is a perfect system. Or sometimes the virus comes into your body, but you lack that receptors, or the receptors are not optimal enough for the virus to proliferate too rapidly. So you are at advantage. So you get asymptomatic infection. The remaining, let's say around 60% of the population who get some symptoms, I would classify them under mild, moderate, severe, and critically ill. Okay, so 4 categories. So you may fall into one of this category if you are not asymptomatic. And most of the people are assuming if they are exposed to the virus here, if they're exposed, they're already assuming this, which is not true. A severe and critical illness is give or take 1 or 2% of the total infections, particularly symptomatic infections. So if you're exposed to a person who has an infection, or you entered a space where there is a virus and inhaled it, so you can be either asymptomatic, there is a 40% probability of it, or there is 60% probability you may have some symptoms. If you have symptoms, there is a very high likelihood you have mild or moderate symptoms. Around 10% of the population are having moderately severe and worse symptoms, because of which they are needing hospitalization. Among them, around 1% are dying. Okay, so that's how it progresses. So who are at risk for this severe infection and critical illness? Okay, so this is our interest. So if you have optimal immune system, and if you are young, healthy, optimal body weight, not overweight, not underweight, and you don't have any heart or lung diseases that are significant, not mild but significant, and non-smoker, you don't have any kidney problems or liver problems that are significant, you are not immunocompromised, and you are not diabetic. So if you don't have those risk factors, then most likely you are going to have mild to moderate infection, where you may have a little bit of fever, some cough, and maybe a little bit of shortness of breath because of inflammation of airway, and maybe some alveolar inflammation as well. But most of these patients, oxygen levels remains above 94%. And you may be retaining a little bit of carbon dioxide, not much. You may have a little bit of fever, a little bit of cough. In these patients, you can treat conservatively with rest, hydration, reassurance. Take some probiotics like yogurt, do some deep breathing exercises, quarantine yourself. Do not spread the infection to others, please. Wait for 2 weeks from the time of your symptom onset before you head out. And by doing this, you will be essentially recovering yourself. And in some rare cases, you may progress from this into this. mild to moderate into severe or critical illness. And who are these patients who progress like that? These are the patients who have those risk factors which I mentioned: cardiopulmonary issues, liver kidney issues, COPD, diabetes, undergoing cancer chemotherapy, immunosuppressed, elderly, more than 60-65 years age group, poor health condition overall, even underweight, significantly underweight, they are also prone to, and high BMI, prone to. So these patients are likely to progress towards severe or critical illness, so which I would call this as a high risk population. So these patients I would call them as a low risk, and these patients I would call them as high risk population, because this population is more likely to succumb, and the other population is likely to recover. So if we have to gear our efforts, it is key that we put our efforts on protecting this vulnerable, this high risk population, which is here. So again, clean it up. So you have exposure, you have infection. Not everybody gets infected after exposure, some of them may, and after exposure you may have no infection or infection. If you are infected, you may be asymptomatic or symptomatic. If you are symptomatic, you may have, if you are a person who have low risk, or you may have high risk profile. If you have low risk profile, you will get mild or mild or moderate illness. If you're a high risk person who has those risk factors which I mentioned, I'll write again, you have severe or critical illness. And except these, everybody else is either not infected or has a mild infection and essentially going to recover fully with minimal or no residual. And these patients are going to succumb into complications, needing hospitalization and may even die. So it is imperative that we identify this population, protect them, and intervene as early as possible into their exposure and illness. Let's say you have diabetes and some lung condition, and you are exposed to someone who has a known COVID infection. You may be either infected or not infected. If you are infected, you may be asymptomatic or symptomatic. If you are symptomatic, you can have mild to moderate illness or severe to critical illness. But since this person with respiratory condition and maybe cancer has these risk factors, they are very likely to progress towards this severe and critical illness. They may start just with simple symptoms like fever, cough, shortness of breath. Then quickly the virus will take over, causing pneumonia, infiltrates in the lungs, their oxygen levels drop, carbon dioxide levels go up. They can become very, what we call drugged, sedated almost, short of breath. Initially the shortness of breath may be only on exertion, maybe on walking, but within 24 hours it may progress to shortness of breath even at rest. So in these patients, measuring oxygen at home is critical. Measure temperature and treat it. Hydrate, keep them hydrated. Quarantine, mask, but do not neglect them because they can deteriorate very fast. If the oxygen levels go below 94%, again below 94%, take them to doctor right away because you need to initiate steroids as soon as possible. And that to high dose steroids, dexamethasone, prednisone or any equivalent. There are other medications as well in these patients that may potentially improve outcomes, and that is beyond the discussion of this topic. But this is the steroids are the key. And of course, controlling the temperature, preventing blood clots, the doctors will take care of it. If you just have low risk profile, that means you don't have any of those risk factors I mentioned. You are young, you don't have any heart lung conditions, your liver and kidneys normal, you don't have cancer, you don't have diabetes, your BMI is normal, and you are below 65. You are low risk profile. If you do get infection, even if you have symptoms, they are going to be mild or moderate. If you have moderate symptoms approaching oxygen 94% or so, you may benefit from steroids even if your oxygen level is more than 94%. However, the more risk factors you have, more likely you will progress towards severe. And the progression can be sometimes very quick. So the key is identifying what is your risk profile, stratify the risk. And if there is an exposure, test. And if they have COVID-19 PCR positive, make sure you keep a close eye on them. And if they are moving towards oxygen less than 94%, which is easily measurable parameter at this time, short of breath, that means they need high dose steroid, hospitalization, and potentially varieties of medications, and even intubation and anticoagulation. So these are the people who are dying. Of course, we have our media that tells anybody who is exposed is dying. This is not true, and that is probably less than 1% who are exposed are dying. In fact, according to statistics, if you test positive, there is around 1% risk in general population of mortality. But if you are in that low risk category, I think it's very, very low. If you are in that high risk category, your risk is going to be very, very high. So identifying that risk stratification will help us to mobilize resources and take care of the vulnerable more effectively than blanket treatment and blanket vaccination. If you vaccinate this highly vulnerable, high-risk population, then I think we are doing a great service to this society, because many of this high-risk population, particularly in developing countries and poor nations, do not have access to vaccines. And there are very low-risk people in affluent, rich nations who are getting vaccines. This is immoral, in my opinion. As a humanity, if we have to grow, we have to help this developing and poor nation so that their vulnerable population is taken care first before we start vaccinating every low-risk person in this world. And in fact, as you can see, not every person is going to be even symptomatic. Even if you are infected, even if you are exposed and infected, your risk of having symptoms is only 60%. And majority of them are just mild to moderate. So these patients will do fine. So I appreciate governments in Asia, particularly Modi government in India, Bharat, India, who mobilize resources to vaccinate elderly. And to that, I would add this high-risk population. So developing a scoring methodology based on these risk factors. More number of risk factors you have, more you are at risk for morbidity and mortality. So developing that scoring methodology is important. If we have that scoring methodology, then we can use our resources very effectively so that we don't provide this blanket antibiotics, blanket steroids to everyone who is tested positive with PCR, which in my opinion is causing harm rather than too good. Okay, so do not get scared. Stratify your risk in this table, and if you are high risk, falling here, which I will put again here, the high risk means diabetes, not well controlled, I would assume, heart, lung conditions, particularly moderate to severe heart lung conditions, not mild, smokers, and somebody who has a recurrent pneumonias in the past, immunosuppressed, like cancer, chemotherapy going on, or other causes of immunosuppression, and excessive immune system response like hypersensitivity. These are also at risk of complications. And liver, kidney issues, particularly moderate to severe. So these, and of course age more than 60, 65, and BMI outside 20 to 25. If it is outside that range, then these groups of people are vulnerable to complications. I would call them as high risk, and more you have these risk factors, more is your risk of complications. So these are the people who will benefit from the vaccination the most. And irrespective, everybody will get infection from this virus. It will go over the world, mutations will happen, that's natural, and everybody one time or other will get infected with this virus, but most of us will recover fine. So scaring the population and people through this media and through the social media and mainstream media by this ill-informed people and corrupted politicians is creating fear factor, and this fear factor is threatening the healthcare system by overloading it. As a physician, I wanted to do something, so I got involved with the e-global doctors, and I'm volunteering for them to advise folks back in Bharat, that is India, and advising them what is the next best step if they're exposed, if they're infected with symptoms, if they're infected but have no symptoms, but they got tested with, and for whatever reason, and they're PCR positive. So we are advising them. So if you have any folks back in Bharat, encourage them to get consultation. It's free through eglobaldoctors.com. And again, it's an advice, not a professional medical recommendation. It's only an advice. But certainly all the doctors who are volunteering there are very well trained, and they're doing this service as a sign of good gesture in the best interest of the world. There is no profit motive or anything like that here. So hope people do not abuse the system of this free service. So a few infographics I will show. This is the information I collected in the last couple of days from my friends as well as from CDC. So this is not my invention, so I just borrowed it from these sources and I found them to be reliable, and hence I'm going to show it. And it gives you some good insights into what is going on. So this first graphic, as you can see, this is in India. Again, the statistics are not accurate anywhere in the world. So there always some lag is there. So there will be always some noise in that data. But you can see Bharat managed things very well until March 23rd or so, February 23rd or so. That's the inflection point. And from there, it's a steep rise. And various causes has been attributed, mutation, gatherings, and blah, blah, blah. In my opinion, it is a complacency of people. Most of these outbreaks happened in places where there were no political rallies or elections or some congregations of religious congregations going on. They happened far away from there. So it clearly suggests that those are not the causes, but it's complacency of people and refusing to follow simple precautions like face mask. Until everybody develops some kind of immunity, it is very important that we wear mask, not only for our protection, but also to prevent the spread of virus. If the virus spreads slowly, then we will have a good outcome as a society and as a whole humanity. But if it spreads fast, then the high-risk people will be at the utmost risk of mortality. This is the second infographic, and as you can see here, this is, again, it's not a big stat, it's a small amount of information, but you can see clearly here the green line which represents a rural population because of a green screen effect. You may not be able to see that color, but there is a blue color and there is a green color. The green color represents a rural population. This is a rural population. And the rural population pretty much got spared in the early wave. And in the second wave, they are taking some hit. And I suspect this is due to their complacency. They are spared in the first wave because they are in a place where there is a less risk of transmission. Houses are far apart, and they followed these precautions very carefully. Prime Minister Narendra Modi was on the top of the things, and he managed it very well. And kudos to him for managing it. Again, because of lockdown, economy suffered. Politicians criticized him for that, and people became very complacent. And the mutations happened, and then it spread very fast. And at this time, they decided not to do lockdown at a government, central government level, so that the economy doesn't take another hit. But now the politicians are blaming him again, saying that he's responsible because he did not do lockdown. He's responsible because he did allow certain religious congregations and elections. And again, we have to remember that these spikes or outbreaks happened in places where there were no congregations, there were no elections. This clearly tells that this is a fault of the people to follow simple precautions that were taught for the last 1 year. They became so complacent, and certainly the mutation did not help. And I will go over some, this is observations from Orissa. And as you can see, same risk factors that I just quoted: elderly, chronic kidney disease, obesity, and again, people who are 30 years old are also dying. Doesn't mean that is a commonplace. 30-year-old person may have diabetes, they may have cancer, they may have heart and lung disease, they may be smokers, their immune system may be compromised, or they may have autoimmune diseases, and so they may have complications, they may be high risk. If you follow what I just said, how to identify high risk population. Age is only one factor, not the factor, not the only factor. It is one of the factor. And interestingly, in this study in Odisha, tribal community is spared, least affected in both waves. Something to ponder over, something to understand how and why they are spared. If we get an idea, it is good to investigate this further. Maybe their lifestyle, in my opinion, their lifestyle is protecting them. And the key thing that will help us now and down the road is change in our lifestyle. I cannot overemphasize it. The lifestyle is a key thing that will help us. Everything else could help. Medicines, vaccines, and all those things. They will help temporarily for this specific variant, specific virus, specific pandemic. But the modification of the lifestyle to a healthier lifestyle will help us not only now, but far into the future. So I believe we have to learn from these tribal communities. And then what is required? Trust. Obviously, politicians are spreading fake news, and that is one of the big problem. The informatic of misinformation, anger, irrational fear, and of course some truth and some lot of myth in even the data. Just because a graph looks colorful, don't be seduced by it. It may be taken from a very bad study, so it's a garbage in, garbage out. Just because it's colorful doesn't mean it's valid and it's trustable. Always question and investigate the graph and the data behind it, why they're producing it, is there any bias to it. Then only you can use such a kind of data to make some graphs. Just because it's colorful does not mean anything. And here, corrupt people exist everywhere. This is, I think, in New Delhi. As soon as the oxygen concentrators became an issue, pandemic became worse in the second wave, these vultures came out. They exist in the society. Some of these are rich people, some of these are politicians, and these vultures hoarded essential supplies, including oxygen concentrators, medications, even hospital beds, jacking up the prices so that an average person suffers. As a humanity, we have to identify these vultures and punish them to the best extent of the law. Look at this, an oxygen cylinder, 8,000 before pandemic, and now 63,000 in Delhi. Where is humanity? Oxygen concentrator, 40 to 50,000 rupees. Sorry, that was rupees. And during this pandemic, second wave, 1.5 lakhs. Almost 3 to 4 times increase, jacking up price. I experienced a similar thing personally during the initial days of this pandemic in March, April last year. A simple surgical mask, we could get a 50 pack for $4. Within few weeks, for almost up to few months, the price went to 20, 25. A $4, $5 one became a $25. I understand economics, supply and demand. I do not think that purely explains that. There is a greed factor here. And I do not think government did a good job at that time to curb this greed of some people. We suffered. We closed our office because we did not have enough supplies to protect ourselves, our staff, and potentially our patients. And now the patients are suffering in Bharat as well. And I'll go over the stats very quickly. And this is a variant, B16172. This is a variant that is now seen in Bharat, and it lacks E484Q mutation. Per my understanding, based on the studies I read and talking to my friends, it appears that the current vaccine, Covid19, Covishield and Covaxin, appears to have a good antibody response that can neutralize this specific form of variant. So vaccine still works in this variant. So don't listen to these corrupt politicians, fake news on the social media and maybe even in mainstream media telling you that you should not get vaccine because it doesn't work against these variants. It seems that it does work. If you are in that high risk category, please go and get vaccine. If you are in that low risk category, you make your choice. Consult your doctor. And this variant, as of May 8, according to CDC, and the presentation of the CDC yesterday, is seen not only in Bharat, but also in Europe and in US as well. And Vaccination rates, again we can see rich countries hoarding vaccines and vaccinating every person, and they now want to vaccinate a child as young as 2 years old. People in poor nations and developing nations could not get adequate vaccines to vaccinate even their high-risk population, and we are talking here to vaccinate people who are extremely at low risk. I think it tells a lot about mindset of certain group of people. Morality should come first. All of us will die one day or other, but our character, our morality, our ethics, our humanity should always be held at very high level. Look at this here, look at here, and look at this one, look at this one, look at this one. This infographic, US has 300 million population and they paid for 1.2 billion vaccines. Is each person in the US, including a child, a newborn, going to get 4 vaccine doses? I would ask you to think about it. Why they need this much vaccine in their box? Please release it to developing nations or poor nations so that they can protect their vulnerable population. This is a vaccine hesitancy rate. As you can see, vaccine hesitancy is not just a phenomenon in one country. It is cross-cultural, cross-continental. It is seen all over the world. And there is a mistrust in vaccines. And that is for a genuine reason. Just because we made these vaccines for everyone, creating some issues, people developed mistrust. If we selectively vaccinate high-risk population and offer it to others on a voluntary basis, the trust factor would have been much better and this hesitancy would have been lower. As you can see, in some countries, the hesitancy rate is 80 to 90%. In India, I would say the hesitancy is because of the fake news and propaganda being spread by corrupt politicians. I will show you one infographic, how these politicians are spreading fake news, creating that fear of even vaccines and telling them not to take it. When Modi government offered vaccine last year, they called it a Modi vaccine, don't take it. And these same people now are telling Modi is not providing adequate number of vaccines. Okay, so these are the types of vaccines that are currently available. Pfizer, Moderna, AstraZeneca, Sputnik V, Covishield, and Covivax. Those are Indian versions. Very cheap. I believe they are like around $3 to $5 a dose compared to $30 or $40 a dose in the US for this Moderna Pfizer vaccines. Some of these are inactivated viral based vaccines and some of these are mRNA based vaccines. I'm not going to say one is superior to other. You can see here there is a 97%, 100%, all these numbers quoted, and these numbers represent relative risk reduction, not absolute risk reduction. Still, in patients who are at high risk, a relative risk reduction of this degree is beneficial, certainly beneficial. There is some colorful narrative being developed with relative risk reduction, saying that vaccines prevent 95% of reduce the risk by 95%. And patients come to my office and some refuse to wear masks saying that they are vaccinated and they are told their risk is 95% reduced. It's very difficult to ask them to put the mask back because there is always a risk of reinfection. They may be carrying the virus and spreading it to others. But because of the information being spread by certain organizations that if you are vaccinated, you don't need mask, they're creating some problem for medical clinics as well. So I would suggest, even if you're vaccinated, please, please, please do wear mask, if not for yourself, for the sake of others. Maybe down the road, once this pandemic is over, we can remove the mask and we can be happy that we showed some compassion towards others. And here, I like this infographic. You can see in the center, this is what media is showing, what is happening. This is what is happening, and media is showing this piece. Why? Because media is busy selling something to you. As a conscious agent, it is your responsibility to explore for the truth. And this is one of the politicians, and I just copied it from Twitter. As you can see, this politician is one of the senior politicians in India. He's saying, oxygen is available in air and can be harvested everywhere. In Modi regime, even that is in short supply, leading to a loss of precious human lives. Who is responsible for these deaths? You, I, or question. This politician has to understand, yes, oxygen exists in the air, 21%. But what we are referring to here is 90+%. We have to concentrate it. It needs equipment. Last year, when Modi government asked various states and hospitals to put oxygen concentration plants and even provided them with funds and technological resources, very few put the oxygen concentrator plants. According to my analysis and research, many hospitals in Delhi and in Maharashtra, states where this second wave hit really hard, refused, saying they would rather put more hospital beds than oxygen concentrator plant because it takes space and it is not going to generate them extra revenue. And now, when oxygen is in short supply, concentrated oxygen is in short supply, they are telling Modi, bring the oxygen and put in our mouth. It is your fault. You get it. Oxygen is not a utility. It is a responsibility of the private organizations, including hospitals, to procure their own oxygen concentrator. Government can help, but do not blame everything for the government. Take some responsibility. And second, healthcare is administered at a state level. For everything, blaming a guy who is doing his best is morally wrong and is wrong at every level. He's doing lots of things to help, but obviously, if people don't help reduce the spread, what else a good leader can do? Anyway, this type of leaders are there all over Bharat, and I believe these are real viruses of the society, and they are making the things far worse than the COVID-19 itself. I would urge everybody, do your own research, find out the truth, but most importantly, let us come out of this pandemic graciously. Wear mask, get vaccine, change your lifestyle, adapt a healthier lifestyle, exercise, good food, less sugars, less processed, more natural food. Do breathing exercises, yoga, pranayams, meditation. All this will help and go a long way to help reduce mortality, not only now but also down the road. Hope we'll all come out of this pandemic with less loss of human life. And good luck to everyone. Thank you for listening. If you have any questions, please put in the comment section. I would answer to the best of my ability. Again, I'm not giving any professional medical advice here. This is purely for information purpose only. Thank you.